Okay, so if you're somebody who's using artificial tears for dry eyes, there's a good chance that you are in fact using the wrong ones. And even if you happen to use the right ones, you might be applying those in a way that could be making your dry eyes worse. Hi, I'm Dr. Joseph Allen. I'm a board-certified doctor of optometry, and in today's episode, I'm going to be sharing my top 10 tips about artificial tears for dry eyes, so that you can start finding relief today. As we get going, I just want to ask that if you enjoy learning about the eyes, vision, seeing your best, and of course learning directly from healthcare professionals, then consider subscribing or hitting the follow buttons so that you don't miss any of our future content. Otherwise, with that being said, thank you for being here, and let's dive in. Tip number one is to go preservative-free. I know a lot of us think of foods having preservatives, but a lot of medications and even artificial tears and re-wetting drops at the store have preservatives in them as well. So preservatives oftentimes in the eye care world have been put in there just for convenience so that you can buy a bigger bottle of liquid to apply to the eye. However, bacteria and other organisms love dark, wet areas, like the inside of an eyedropper. So they add preservatives to it. Now, the biggest preservative you want to be aware of is something called BAK, or benzalkonium chloride. If you're not sure if your other eye drops that you've been using have that in there, you may have to look at the back of the box or the back of the bottle and look under the inactive ingredients. If you see BAK listed there, or again, that term benzalkonium chloride, then that is one I often recommend people to avoid. The reason why is benzalkonium chloride can not only disrupt the tear film, but also has been found to cause allergic responses. In fact, I myself have an allergic response to BAK, and I found that out through a nasty experience in optometry school. And then it also has been more recently found to cause damage to the nerve endings on the surface of the eye, and may even induce damage to the glands within the eye and the eyelids that help produce tears in the first place. As just a general trend, the industry has shifted to more preservative-free options. These are often sold in small individual vials, or they now have more complete, more standard-looking eyedropper bottles that have a specialized compartment that allows it to also be preservative-free. Most eye doctors agree that if you're using artificial tears more than 3 to 4 times a day, switching to preservative-free is best, but many of the dry eye specialists that I know just recommend preservative-free no matter what. That's the best option. Tip number 2 is to avoid the get the red out type eye drops. I know if you go to the store, it can be overwhelming to see so many different options, and you may shrug your shoulders and think, you know what, I'm just going to get the cheapest one that's out there, something that'll make my eyes maybe look whiter than they are, and that can be tempting. The downside is these get the red out drops, they're often formulated in the 1960s and 70s and have ingredients that, while do cause vasoconstriction, making the eyes look whiter, they often rebound several hours later, causing the eyes to look even more red. In addition, these formulations typically don't have that much therapeutic effect for something like dry eyes, and oftentimes do also include the preservative BAK that we just mentioned. And probably the biggest issue is that then when you come in to see myself or another eye doctor, it becomes challenging for us to decide if the irritation, the redness, everything that's going on is because of these drops, or is there something more like systemic going on underneath that's causing the redness and the dryness in the first place. So if your eye drops say, get the red out on them, then these drops are not treating your dry eyes or how they feel, but instead they're treating how they look, which I admit is still a very important topic, and so we'll save that for a future episode where we'll bring on an expert to share with us their thoughts on what causes red eyes and truly how to get rid of them. Number 3 is that there is no best eye drop for dry eyes, right? There is not just one eye drop that it works for everyone. If there was, you'd go to the store and there'd only be one brand there. The reality is that dry eye disease is extremely complex. It is multifactorial. There are many different drivers. It is not just one disease, it is a spectrum. Several major studies have been looking at just artificial tears and better understanding which eye drops may work better or which formulations will work better for different types of dry eye. And Certainly, we're going to be talking and highlighting some of the findings throughout the rest of this episode. And in case you want to read these yourself, again, I always do put links in the description or in the show notes below so that if you want to be an eye doctor nerd like me, you can dig those up and read through them yourself as well. But a common thread amongst all of these publications show that the best artificial tear or the best eye drop for dry eye depends on why your eyes are dry. Not just the fact that they are dry, but why? What is the underlying driver? So don't just shop by brand, shop by your type of dry eye. Tip number 4 is to match the drop to the problem. And this really comes down to understanding what type of dry eye that you may have. In the field of eye care, we think of it either having aqueous deficient dry eye, where you don't produce enough of the watery component of the tears. This is often for people who have autoimmune related dry eye, or maybe they had LASIK eye surgery and their brain isn't getting the signals because the nerves are severed during surgeries like that. And so the brain is not sending signals to the ocular components to make more tears, your own natural tears. And so these eye drops are usually just water replacement type of eye drops. It's not just the water you get from the tap or anything like that. They are formulated with the right pH and the right salt content, but they're just to help lubricate the ocular surface because you're not making your own. Then there is evaporative dry eye, which is in fact a lot of people because many of us do have some deficiencies in our meibomian glands. These are glands in the eyelids that produce a little bit of oil. We've talked about these in a lot of previous episodes, but these glands, if they stop producing, then your tear film becomes unstable, and then your tear film evaporates very quickly into the air. This is happening for a lot of us, especially if we're sitting in front of computer screens or phone screens a lot throughout the day. And so a lot of the lipid eye drops you find at the store will contain either mineral oil, they'll contain flaxseed oil, or castor oil as a lipid component to help stabilize that tear film and help prevent it from evaporating. And then finally, probably the largest area where most people do have some dry eye is a mixed category, which is a combination of the two, right? It's a combination of not only evaporative, but also some aqueous deficient. And so now some newer formulations have been coming out specifically to address both needs. And so this one I think most people can rely on just as starting out if you're not sure what type of dry eye you have. But ultimately, the best choice is to see an eye doctor, see somebody who specializes in dry eye, and get a proper diagnosis of what your drivers may be so that you can get a better recommendation of which types of drops may work the best for you. If you're not sure how to find a dry eye specialist, I have created some previous content on tips on how to find a doctor in your area, and I'll put some links for helpful resources in the show notes. Now, tip number 5 are going to be to look for these key ingredients. I'm not going to go super extensive on this, but I want to list out a couple ingredients that I look for as somebody who's read all this published research on these various eye drops. But when I flip over the back of the bottle, I look for these type of ingredients. And note, they're not always listed as the active ingredient. They're sometimes listed as the inactive ingredient. The first one here is hyaluronic acid. Hyaluronic acid you may be familiar with because it's beneficial for your skin and used in a lot of skincare products, but they have found it to be helpful for moisturizing the eye and with healing of the ocular surface and the damaged cells. This has been shown in a few studies, especially for post-LASIK or post-cataract surgery. And so again, this is one ingredient I look for. Another one that's shown up in the research is HP guar. This tends to thicken the artificial tear and make it a little bit more tacky, but it's supposed to help with spreading of the tear film and keeping it retained on the ocular surface, basically having a longer lasting effect. One osmoprotectant that I often look for is something called trehalose. This, as an inactive ingredient, has been found to help stabilize the tear film and potentially be beneficial to any cells under stress. And so if somebody has surface damage to their eye, this may be something that has a beneficial effect. And then finally, there are some ingredients to help stabilize the lipid component of the tear film. Again, most commonly I see mineral oil. It's not my favorite ingredient, but I think historically it's been used the longest. But then now you'll see eye drops that contain either the flaxseed oil or castor oil. And this is usually at a very diluted percentage, like 1 to 2% castor oil, but that has been showing a lot of benefit. But oftentimes it's not just one ingredient that makes the formulation work, it's a combination of many of these ingredients that ultimately help stabilize the tear film even better. Tip number 6 is that of consistency. You can't just expect to try an eye drop just once, maybe twice, and then kind of throw in the towel and say it didn't work. Kind of like buying a gym membership. If you go in, lift weights once, you can't expect it's going to completely transform your health. You have to be going on a consistent schedule. And the same sort of thing happens with dry eye and eye drops. If you're somebody who knows that you've had chronic dry eye issues, right? Everybody will get a little bit of dryness once in a while on a windy day, or if they're sitting in front of a computer screen for a long period of time. But if again you struggle with chronic dry eye, or eye doctors have told you, hey, this is a concern, usually using an eye drop at least twice to 4 times a day is what has been shown in several publications to have positive outcomes. And for people with more severe or chronic dry eyes, it means usually doing this for at least a month, sometimes longer, depending on what the cause is and the severity. I will call out that there is not an extensive amount of research into exactly what the perfect amount of eye drop usage is. However, between a lot of other eye doctors that I speak with, dry eye specialists, there is possibility that you can overdo artificial tears, that using artificial tears too often could in fact cause dry eyes to get worse, not just because of existence of things like preservatives, but because our natural tear film has healing properties to it, right? Our natural tears that are produced by our body contain electrolytes. They contain proteins, immunological factors. Basically, your tear film is trying to heal the surface of your eye on its own. And if you're constantly putting in these artificial tears, these kind of mystery fluids onto the eye, while it may help replenish and prevent true like dryness damage from environmental exposure, it may be diluting out some of those other like healing properties that are naturally in our tears. Now, with that being said, there are some people who do have true, like they are not producing any artificial tears on their own, like their nervous system, their nerve impulses to their glands or their glands have been gone and they're just not producing any liquid, then yes, you need to be supplementing with some other forms of protection on that surface, or you have chronic exposure to the outside environments because your eyelids don't close all the way. In those special cases, eye doctors may be recommending to use those types of artificial tears more frequently. However, I think it's important to discuss with your local eye provider how often they think you should be using drops, or at a certain point, do they want you to back off and not use them as frequently? But from the perspective of not just improving your symptoms, but from healing the ocular surface, again, try to stay consistent. Tip number 7 is don't rely purely on your symptoms. I say this because if you use eye drops consistently for several weeks, you may notice your symptoms of dryness have largely improved, but the ocular surface may have not completely healed up. At that same time, it could be the opposite way. Dry eye is complex like that. You may be somebody who's used eye drops for several weeks and feel a little bit better, but hasn't gone completely away. Yet when the eye doctor looks at it, it looks like it's completely healed or looks much better. However, that could be because the neurosensory bed, the many nerve endings on the surface of the eye, have grown deformed or been altered by the chronic nature of dry eye. And so that can take 3 to 6 months for those nerves to fully heal. The long story short is that just because the eyes feel better doesn't mean the eye is completely healed. Tip number 8 is to use thick gel drops or ointments at nighttime. This is especially important for people that may sleep with their eyes cracked open a little bit. I know a lot of us maybe think, oh no, I don't sleep with my eyes open, but we may fall asleep with our eyes closed, but as soon as your body fully relaxes, your muscles may let go and your eyes crack open just a little bit. So if you're somebody that wakes up and your eyes feel gritty, sandy, or more red, this could be the case. Or if you're somebody that sleeps with a CPAP machine, this also is very common. In these cases, using a thicker gel drop or again an ophthalmic nighttime lubricating ointment, these are going to add a better protective effect, seal that eye up, and prevent the tears from evaporating or having dryness damage. In that same light, I just want to emphasize sleep is super important for not just the eyes, the whole body, but there have even been publications showing that one night of decreased sleep can significantly alter the tear film chemistry, leading toward dry eye and dry eye symptoms. So please, if you're going to do one thing, prioritize your sleep tonight. Tip number 9 is that if one drop isn't working, switch strategy, not just brands, right? If you've been consistent with an eye drop for about a month and you're just really not seeing any changes, then don't just switch to a random brand. You want to switch strategy. Ask, hey, should I be switching to a lipid-based drop? Maybe you need a drop that lasts longer, is thicker, something like a gel drop. Or, of course, ask yourself if you have been consistent with those drops. Have you only been using it once or twice, maybe every other day? Or is this something you have been consistent with on a daily regimen? Because if you've tried 5 different drops and nothing works, you probably don't just need a different bottle, you need a different approach. And then tip number 10 is that eye drops are step 1. They are not the whole treatment. I think a confusion point for a lot of people is that eye drops are not going to have necessarily a therapeutic or treatment effect that they expect. Because again, there's many underlying drivers to dry eye. So these eye drops you find at the store, they're not going to resolve the inflammation that is driving a lot of the underside parts of dry eye disease. They're also not going to have a therapeutic effect on the meibomian glands of the eyelid or the lacrimal gland. And if you have nerve-related eye pain, they may soothe some things, but it's ultimately not going to change how the nerve functions. Where eye drops really excel is coating the surface of the eye, stabilizing the tear film so that you have better vision in between blinks. Also to help coat the surface of the eye, protect it from the environment, and give the surface a chance to heal. Especially in cases where somebody's just not producing enough tears in the first place. Artificial tears definitely have a place in dry eye care, but they are the foundation, not the full solution. Now, my hope from today's episode is that you get a better understanding of kind of the complexities of using artificial tears, especially for symptoms of dry eye, and that you feel more well-equipped when looking at various products at the store, and of course, what to talk to your eye doctor about if you're having chronic symptoms. And just the appreciation that, yes, artificial tears have a place and can help quite a bit, but oftentimes, true dry eye disease is best treated and managed with medications, in-office procedures, or even lifestyle adjustments that help address the underlying drivers of the dry eye. And finally, if you are one of those people who's genuinely curious of what drops I either use myself or have found great success with my patients, then I will include a link to a PDF in the show notes, which is one that I keep periodically updated based on the new formulations that are coming out and what surfaces in the research. This includes not only drops for the different categories of dry eye, but also just ones that have good deals that are affordable. Otherwise, from here, let me just say thank you so much for tuning in. Keep an eye on it, and we'll see you in the next episode.
You've been listening to the Dr. Eye Health Podcast with Dr. Joseph Allen. For more resources, trusted information, and helpful tools, visit dreyehealth.com. Thanks for joining the community that's focused on healthier eyes and a healthier life. Until next time, stay informed and keep your vision sharp.